Hey, how's everybody doing? I'm Adam P. Geiger. I'm a LMT, Ohio licensed therapist. In this video, this is going to be about all about the neck, just a whole neck routine, uh, and things I would start out doing if it were a full body massage, and and then from there, I'm going to just do some other techniques that would be nice for people to have. These are things you need to be getting done besides chiropractic adjustments. Muscle pulls on bone, so you're gonna, when muscles get tight, they all gonna pull on the bones and pull things out of place. That's what's gonna cause the back pain, the hip pain, whatever. And it all needs to be stretched out and massaged. Now, when the chiropractor is just adjusting you, he's just adjusting you, and it's a quick fix. And as far as the neck goes, they're gonna crack your C1, C2. They're gonna move your head this way and crack, this way and crack, and that's all it is. And you think they're doing something, and they like to hear those cracks. Massage is just working out the muscles, the tension that are around those bones and joints. And it all needs worked out. Normally on a woman, I would have her draped, or if it's a man. But being in shorts, and depending on what the weather's like outside, it doesn't really matter. I'm a sporty guy, so I'm not really wearing scrubs right now either. So, alright, we're going to get started. What I do is, normally I do a facial routine and all that stuff. Then I can do some traction on the neck, pulling. However much I want to do that. And then I'm going to just check for tightness on the neck. Pulling the head up this way. Relax, just relax. Pulling it this way, checking the tightness. And he's got some tightness. So that's a good quick assessment. I like to get my arm up underneath the neck like that. And then push on the shoulder a little bit. Stretching all this that way. This traps the neck muscles. And then I'll just switch to the other side. Do the same thing. Feel that stretching? Do that for however long they need it. Just relax. All this stretching is just what you need. Very important. Not just a crack. You need all these important services or techniques done to you. And then what else I do is I'll just open up the chest, just do this whole routine here. Alright, just like that. Just bring my hands up like that, up the neck. And then I just repeat this 2 or 3 more times. You're just opening it up. Now, again, on a woman, I'm just kind of coming right in between here to the sternum, halfway. And she's still draped. I'm coming in like this, over the shoulders, under the back. And I'm still working the traps under there, the rhomboids a little bit. Bring my hands up the neck. You want to get all those worked out too before you go and rotate the neck too and do something like this. Working the neck and the occiput there. as you can see, my grandpa's sleeping. He's either sleepy or he's falling asleep. But it's all relaxing, so that's going to happen. Plus he's 84 years old, not to mention. So you do, that side, and then you switch to the other, rotate it, circular motions, friction, whatever you want to do. Long ways with the muscle, cross fiber, just things like that, the whole stretch. Usually I like to take my fist. This is what you need done too. I take my fist and I rotate them up on the traps. His muscles aren't very thick. Now, in somebody who might have thick traps and thick everywhere, muscular or whatever, it's just going to really feel good. I'm going to be able to dig into your muscles like that and work all that out like this. And if there's any muscle imbalances, like one side is thicker than the other, I just dig in with my fist and work it out. And that's going to prevent the headaches, the migraines, neck pain, any trigger points. If it's tight up here in pain, it's going to send radiations or sensations down your shoulders, your arms. You have your brachial plexus nerves sticking out or coming through, and any of those can get entrapped and cause sensations down your arms or cause similar symptoms to carpal tunnel. So you have to watch out for that. Speaking of carpal tunnel, it could be your forearm muscles that are tight and need worked out, and you need to find the trigger points that are causing it of that median nerve coming down into the carpal tunnel. So it could be that, or it could be pinched nerves up here, and you call that thoracic outlet syndrome. So before you get an expensive test done or get prescribed any pain pills, you need to just get all those assessed too. You want to get everything assessed, just make sure it's not a huge nerve problem, internal problem, or just a muscular problem. Alright, so that's that simple routine there. And then I would just go on doing their arms and their legs and whatnot. But I'm just concentrating on the neck stuff. Alright. I think I might have you lay on your side now, this time. Face that way. Face that way. Okay. Try and scoot down a little more if you can. Scoot down a little more towards that direction. Okay. Head down. Besides having the bolsters, it's nice to have pillows available for the clients. So if you come to me, I will have pillows for you. This is good to have the pillows between the knees like this, especially when you're sleeping at night. Alright, and then again, if the person's trap muscles and neck is all tight, I would normally push on his shoulder like this. I'm using my left hand on his right arm, so opposite hands. And then I'm taking my other fist and digging in, up and down, not too tight, depends how thick they are. And just up and down, or I can just do these motions counterclockwise. So this will be what I would be doing on you if you came to me. Loosening up all this, all that, and then running down this way. All this is going to relieve pain and the tightness, nerve pain, all those things. Again, I can't say this enough. Doing all this stuff is more effective than chiropractic treatments all the time, cracking out your bones. And then what I'm going to have him do is push his shoulder in towards me. I'm going to provide some resistance and let my fist run down his neck. So you're going to bring your shoulder in towards me. You remember doing that before? Keep your arm up here. All right, push your arm towards me, your shoulder. No, keep this out. Push your shoulder in like this, like you're shrugging your shoulders. Right, hold on. Okay. Right, start over. Okay. Again. Okay, that's good. He's pretty strong for 84, but you just gotta get a lot of resistance provided for you. So things like that. Another thing I was taught was I can come in like this and take my other hand, or my thumb side, thenar eminence, and like that, or I like to take my hyperthenar eminence, or my ulna side, and just do that, stretch out. That's something you would get done on both sides. Another quick thing I'm going to show is the back a little bit. Okay. First of all, like another thing, also I could just take my elbow and drive it down on a trap like this, if the trap was pretty thick traps in there. I can dig my elbow in like this around a shoulder blade, up in the rhomboids and things. I'm going to have him reach in front of the table like this. Now this technique here, it's good for if you're trying to, you want to get your chest and back to expand out, which it needs to do, and you want to get your lat muscles loosened up, compressed on. This is another good technique for the ribs, muscles in between the ribs. So I'm just kind of springing like this. Like about 20 pounds of pressure or whatever. Just springing everything, and that will help the rib cage expand out more and loosen up all the muscles in there, the lats and your inner intercostalis, external intercostalis or costal muscles, things like that. And I'm just rubbing. And then what I'm also going to do on a person is take my forearm and rub it up the ribs here, and up the lats. Come on the outside, I can come in inside more. I can, again, take my elbow, rub it like this, and I can just kind of do circular motions, circular or cross fiber against the muscle fibers, or elongated or along with the muscles. So it's just a lot of physical stuff. Some people don't want to put this work into it when they're helping somebody. They just want to do a quick fix on you, like the chiropractors or doctors who are giving pain pills out. I'm not a fan of all that stuff. I want to get physical and help with everything. And then in the other video I showed, you know, this is another technique that would be good for the hips while they're on the side. You just pull down like this, pull their iliac, separate it from their rib cage or obliques. That's something that I could do while you're on your side, but those are typical good things I would do for the neck and that neck pain. But obviously I would take a lot more time on it, a half hour or so. And things like that, switching both sides. So I think that'll conclude this video here. And please stay tuned to my other videos on what I do for people. And if you happen to be local, just give me a call. I'll come on over. Thank you so much.